Urinary tract infections can be anywhere from annoying to deadly. So here are my tips for prevention, and I'm willing to bet you haven't heard of the last one. UTIs are very common in women, or anyone assigned female at birth, due to our anatomy. Around 10 to 13% of women will have at least one UTI each year, and about 60% of those people will experience a recurrent infection. UTI prevention starts with routine habits. You'll want to make sure you're drinking enough water to produce light yellow urine, which will flush bacteria from the bladder regularly. Always urinate within 30 minutes of intercourse. Always wipe front to back. You don't want to accidentally introduce bacteria from the GI tract into the urinary system. Avoid using irritating products in that area. No scented anything and no harsh soaps. You do not want to disrupt the natural microbiome down there. And consider wearing cotton and loose-fitting underwear. What about the over-the-counter options? D-mannose is a sugar that may prevent some bacteria from sticking to the bladder wall. Studies thus far do show some promise, especially for recurrent UTIs. Now for cranberry products, otherwise known as PACs. The effectiveness of these is highly debated and weak at best. If you do want to try this option, I would steer clear of the high-sugar cranberry juices. Consider standardized PAC supplements instead. Vitamin C is thought to acidify the urine and create a less friendly environment for bacteria, but studies on the efficacy of this is really mixed, and vitamin C is also well known to irritate the bladder, which can actually worsen symptoms like bladder spasm and pain. There are also multiple prescription options for people dealing with recurrent UTIs. For sexually active patients, a postcoital single-dose antibiotic can reduce the rate of UTI recurrence by up to 80 to 90%. When taking a low-dose daily antibiotic is also an option, but this is usually reserved for people that have a high risk of hospitalization from UTIs or other risk factors. Another option is methenamine, which is not an antibiotic, but rather an antiseptic agent. It more or less sterilizes the bladder, and it's highly effective, reducing the rate of recurrence by about 2/3 without the use of antibiotics. The last prescription option is actually a favorite of mine because it can do so many other great things too. Topical vaginal estrogen cream, or suppository tablets, can make a huge difference in anyone going through menopause or other estrogen-suppressing therapies. Topical estrogen has even proven to be safe in people that can't otherwise take systemic estrogen therapy. Okay, final tip. I actually recently learned about this one myself, so of course I had to share. There's actually an oral vaccine against UTIs. This vaccine contains antigens from the 18 most common UTI-causing bacteria, and allows your body to create its own targeted immunity to these strains. But there is a catch. It's not yet approved in the US. But clinical trials are ongoing. So if you're interested in joining a trial, head to clinicaltrials.gov to see if there's an open trial near you. Consider checking out my Substack for an even more detailed article on this topic, and remember to follow for more content like this.